So, all right, we're recording now. Hello, welcome everyone. My name is Susan Stein. I'm a board member of Friends of the Dominican Republic. I served in the DR myself from 2013 to 2015. I overlapped with Tiven, so it's great to see some overlapping volunteers participating tonight. We have several other board members here tonight who might chime in or ask questions as well, including Kim Herman, who's president of Friends of the Dominican Republic. I'm going to stop sharing my screen here now so we can see the panelists better. How tonight is going to work is we're going to go through a series of different topics. I'm going to pose some questions to the panelists, and then the different NGO representatives will respond. We're going to talk about the NGOs and their primary missions, how they've been responding to COVID-19 in the DR, how the RPCV community can help, and then we'll open up for questions at the end. And so first, I'd like to give the opportunity to all of our NGO partners to introduce themselves. I'm going to start here with our Puente de Desarrollo Internacional team. Scott, would you like to start?
Yeah, absolutely. Thank you, Susan. So my name's Scott. I'm co-founder and CEO of Puente. I served as a health volunteer in the Dominican Republic from 2015 to 2017.
And I'm Tiven. I'm the director of WASH here at Puente. I also served in the DR. I was in the education sector from 2014 to 2016.
Great, thanks. Techo with Carlos and Camila.
Hi, I'm Carlos from Techo. I am the local director of Santo Domingo. Camila is the binational director of Funds Development, and we're very happy to be here with you at this moment.
Great, thanks, Carlos. Wine to Water. Joel, do you want to start off?
Yeah, yeah, go ahead, Joel.
Or Stephanie, ladies first. So
okay.
Go ahead, Stephanie, por favor.
So I have the fortune. First of all, I invited myself. Joel was originally invited, but being a former Peace Corps volunteer myself and now working with Wine to Water, I'm honored to be with you guys. So I'm the director of international programs for Wine to Water, based out of Boone, North Carolina. And we have, of course, Joel con nosotros, and also Tony Ricciardi, who is new to our team in Boone also. He is our international operations manager, coordinator manager.
Thank you for letting us invite ourselves to this.
Oh, the more the merrier with these types of events. And then we also have Brendan Fields from Rustic Pathways, who was my PCVL when I was in Peace Corps.
Hi, y'all. As Susan said, my name is Brendan Fields with Rustic Pathways and the Rustic Pathways Foundation, the Community Impact Manager. So I oversee our projects here in the DR. And yeah, happy to be here with y'all tonight. I was a Peace Corps volunteer in the education sector from 2012 to 2015 in Bani and Santo Domingo.
Great. All right. So we've gone through our introductions of our NGOs. But first, I think, Kim, would you like to talk about how we started working with these NGOs a few years ago?
Sure. Thank you, Susan. John Epler, who runs our Community Challenge Fund, when Peace Corps changed about 3 or 4 years ago, when they changed their focus and started, focusing more on education and some other things that didn't deal with the kind of infrastructure programs that we fund through the Community Challenge Fund. We coordinated with Peace Corps DR and looked at about 8 or 9 different NGOs that Peace Corps was familiar with or other groups in the DR were familiar with. And we went down and interviewed about 6 of those NGOs after talking with them and exchanging information. And then we selected 3 of the 4 you see tonight, the Techo, Puente, and Wine to Water as the first 3 of those NGOs that we wanted to work with. And that way we can continue providing programs in the Dominican Republic and keep helping Dominican citizens. We've now helped over 50,000. And then also we have the Program Support Fund, which is more dedicated towards supporting volunteers in country. But we recently used some of that money to fund Brandon's program for the distribution of health kits and food that during the pandemic. So we're constantly looking for ways to continue our programs in the Dominican Republic, and that's why we're now operating with NGOs, and we think it's been great. We've had just great success with everybody we've worked with. So I'll turn it back to you again, Susan.
Great, thanks, Kim. So we're going to start off by giving the NGOs an opportunity to introduce what their organizations do. So I guess we'll go in the same order. So would Puente Soraya, would you like to start off with your organization's mission and yeah, your organization's mission, sorry.
Sure, yeah. So I can also start with a little background about ourselves as well. So
great.
Puente was founded by RPCVs of the Dominican Republic, and it was mainly founded by our experience throughout Peace Corps, our Peace Corps service. So during Peace Corps, we realized several things. One of the most glaring things was most host country nationals could be doing the same work we were doing, just as well, if not better, given the resources that we were given as Peace Corps volunteers. Because, who knows the community better than the residents that live there? So we also realized that there was a disconnect between international NGOs in the communities they were serving. Mainly that data was lacking to drive their mission. And if they had data, sometimes it was pretty hard to piece together and really determine their impact and really the reporting side of that. So, and then lastly, host country nationals weren't driving their initiatives, right? Host country nationals weren't heavily involved with the planning and in the actual implementation. So our solution was to create a community development course and a mobile data collection platform, which combined to create a more collaborative approach to development. So, in short, host country nationals use our training program and our technology to prioritize needs and solicit help accordingly. Our overall goal here at Puente is to give host country nationals the keys to drive their own vehicles of change, right? So Puente means bridge in Spanish, which you all know, but we are doing just that, right? We are bridging emerging communities with organizations that can help, all of which is driven by data. And the other RPCV that I mentioned is Hope Tambala. He couldn't be on this call, but he sends you all his best.
I'm here.
Oh, Hope. Hey.
Nice.
Fantastic. Always great to have surprise guests.
Yeah, that was fantastic. Yep.
All right, great. Techo, Carlos, or Camille?
Yes, well, Techo born in Chile in 1997 with a group of young people who began working towards the dream of overcome poverty. The sense of urgency that exists in these slums massively mobilized them to build transitional houses together with the families, beginning to create that symbiotic and that working together symbol. And it's especially work in slums, massively mobilize these young people and them to build transitional houses. And then we began, this group of young people focus their energy on finding concrete solutions to their problems that the communities faced every day. And this initiative became an institutional challenge that today is shared across the continent. It began in Chile, but today that we are in 19 countries in all Latin America. And since its beginnings in Chile, Techo undertook an expansion, and after 15 years, has maintained operations, as I told you, in 19 countries. And I think essentially Techo is born every day from the encounters of volunteers and families living in slums, working together to overcome poverty and exclusion. Here in Dominican Republic, Techo came in 2008, the first explorations, the first data and surveys with the families. And in 2009 was the beginning of the first housing solutions, emergency housing solutions. And today we have built more than 1,000 emergency houses. We've been in more than 60 communities all around the country and mobilized more than 36,000 people's will, as we say. And we seek to build a fair, integrated, and poverty-free society where everyone has the opportunities needed to develop their capacities and fully exercise their rights, fully forward to develop capacities in communities, also in the young people, that make this fusion between these two sides of society. And that's basically what we do.
Great, thanks, Carlos. And Wine to Water?
Okay, yeah, so Wine to Water was actually founded by our founder, Doc Henley, who was a bartender and also a musician playing in nightclubs in Raleigh, North Carolina. And in February 2004, he held his first fundraiser. And by August, he was actually living halfway around the globe in Sudan. And I'm not going to give all the history of what took him from Raleigh to Sudan, but he was hired to install water systems for victims of the government-supported genocide. And so after that, as you can imagine, his life literally never was the same again. And so after spending about 1 year in Darfur, he returned home. And, you know, again, as you can imagine, the haunting memories of all of that and what he witnessed drove him to continue building the organization Wine to Water. And he started with that first fundraiser in a bar. And now here we are. But his main primary goal, which still remains today, was to provide clean water for the world. And then in 2007, after working 2 jobs and volunteering his time for 3 years, he launched Wine to Water. And, you know, his dream of fighting the world's water crisis then really became a reality. And that was just the beginning. And to sum it up, today we've grown to 4 international teams that are all registered nonprofit organizations in their home countries of Nepal, Colombia, Tanzania, the DR, and I think I mentioned already our global headquarters are in Boone, North Carolina, where Doc was raised. And we've got about 20 employees in Boone, and honestly, our employees around the globe are starting to increase again now that our work is picking up. So I can't even tell you how many we have, but we've got some incredible teams out there.
Great, thanks, Stephanie. And last but not least, Brendan with Rustic Pathways.
So Rustic Pathways is a student travel company that's been around since 1983. And the mission of Rustic Pathways is to empower students through innovative and responsible travel experiences to positively impact lives and communities around the world. So if we take the second half of that mission, that's where the Rustic Pathways Foundation came from. The foundation is the 501c3 nonprofit fundraising arm of Rustic Pathways. Excuse me. And the foundation really was born out of a desire among student travelers and people in their networks, teachers, parents, to stay connected to the places where they were traveling and keep supporting the kinds of projects that they were working on. Here in the DR, we work on projects related to housing, infrastructure, access to water, environmental conservation, health, education. And so the foundation, besides being able to channel donations to fund these projects when the students aren't around, is also able to stay kind of connected and maybe support bigger projects that high school students can't really do. So here in the Dominican Republic, the foundation project, as we call it, is a housing project in the Batey Montecoca in Consuelo, near San Pedro de Macorís. And so that's building houses for 40 of the most vulnerable families in this batey, as identified by the committee that the community created for that purpose. And yeah, the foundation is also active in other countries around the world. I think there are 8 active projects besides the DR. And yeah.
Great, thanks, Brendan. I think Brendan got a little bit to part of my next question, which is before COVID-19, what were your primary projects in the Dominican Republic and where were you working or focusing your work? And later on, we'll talk about how that has definitely changed since COVID-19. But if it was normal, 2019, what was going on for you all in Dominican Republic? And anyone's welcome to start things off.
Since I already stole that question, I guess I can just fill out the rest. In 2019, besides the housing project, we were building small-scale rural aqueducts up around Jarabacoa and Manabao, up near where Puente is, kind of. And also running a summer camp for kids from the very same bates that are near Montecoca. Also building latrines and cementing floors, and then partnering up with the NGO from the Mar in Bahia to do coral restoration and marine conservation projects. So that's kind of like a little bit of where we were in the map.
Sure. We can pick up, Puente can pick up next. Brendan, I'd love to catch up with you because we do a lot of similar work. Brendan was my PCV when I was a volunteer as well, so that's pretty cool to see you. In terms of our projects here at Puente, you know, we don't really believe in a one-size-fits-all solution to community development. Our software was really built to gather that diagnostic data and put that data in the hands of the host country nationals so that they can identify and prioritize their own needs. And so with that, you know, we're open to really any projects in all sectors, as long as, you know, the data supports the need and the need is solicited by that community. With that being said, we have focused our efforts heavily on WASH, that's water, sanitation, and hygiene within that sector. And with the help of some really great partners like FDR, Wine to Water, Constanza Medical Mission, we've been able to construct 83 bathrooms, 66 cement floors, 3 rainwater collection systems, and distributed 228 water filters here in Constanza. And all of that work was done the last 2 years.
Yeah, huge shout out. But yeah, another large component of our work here on the ground is focused on health. So our app and our volunteer network support medical missions who have seen, you know, 400 plus patients per trip. And then after these missions, our volunteers provide these patient follow visits to 200 plus at-risk patients for chronic conditions, which, as you can imagine, is quite the task to go through these communities and find all of these patients post-medical mission.
Yeah. And all of our projects, they require 25% of the community buy-in, and they all come with an education component. So when we do that implementation, we always give a charla or a workshop, and we provide them with information on things like how to improve their health, their sanitation, and just how to live, you know, an overall better, healthier lifestyle.
Today, we've really been focused in the Constanza area where I served as a Peace Corps volunteer, and we formed so many great connections over the years. You know, we've expanded a bit to Tereo, if anyone's familiar with that little pueblito outside of Constanza, and then we just extended to Santiago this past weekend, which is really cool. But that's, you know, future. That's not 2019. But yeah, those are all the physical projects that we have done. Not really including those programming, the community development programming, and the soon-to-be WASH programming.
So I have a question in the chat for Puente real quick. Someone wants to know if you know the Alto Cerros Hotel in Constanza. I'm not sure if that's a current hotel or, yeah, okay.
Yeah, my parents stayed there for Christmas. Great spot.
Oh, and the person Tom wants to know if you receive support from the hotel.
We have not received support from the hotel. I have spoken to the owner, and it was a great conversation. I need to follow up. That reminds me, but we have worked with Domino Nino on a couple of projects in regards to health and supplying medical equipment. Yeah, the Alto Cerro, that'd be a great option, and thank you for bringing that up.
Yeah, and I'll chime in for Wine to Water, and then just a warning, Joel, I'm gonna have you tag on if you want to. But in general, in the Dominican Republic, we're based in the community of Moca, And our teams are working, and we're working and still working on a social enterprise programming through the production and sales and distribution of ceramic water filters. And also the implementation of community wash, primarily in schools, training programs. But Joel, I know you're going to have some more details for us.
No problem. Thank you. And we have a unique situation because the factory which we run, Wine and Water, was originally by another nonprofit. You probably all know Agua Pure, which is founded by Lisa Valentine, a good friend of ours. And so we've been actually in the island for almost 14 years. And we distribute these water filters with the only factory, homemade filters in the country for Haiti, as well as for the DR. So our filters are all over the island. We've distributed over 100,000 filters, not just by Wine and Water funded filters, but thanks to you guys, a lot of nonprofits, a lot of them are here now, can speak for them. I can't speak for them, how awesome it's been to take these filters, not just to rural areas, but to schools. I remember when John came, he came in, I think it was the fall of 2019, and we gave a whole tour, and I introduced myself, and he saw the factory. Back in that day, we were doing GSP groups. We were having school programs, the whole 9 yards before COVID. But as you all know, everything kind of stopped. But back in January, we started the Water for School program, implementing water filters and wash education at the schools. And in a quarter, we were able to do 24 schools, which was great. And FDR, thank you guys for helping us to set that up. And so when COVID came, we were basically in such a great setup that we can continue now doing COVID response. But before that, we have a full-blown factory. Most of you have seen it. We have tons of filters there. We have a huge place to host events and bring people that used to come from Puerto Plata. They used to come from the States, from all over we give them a tour. They make filters with us. We can bring school kids to the factory and host events. And that's, our activity has been pretty much there since 2006, and Wine and Water in 2017, when it originally became a nonprofit, Fundación Wine to Water, DR.
Thanks, Joel. And Carlos?
Yeah, well, for us has been very challenging because all of our intervention is about massively mobilizing volunteers, and right now massively mobilizing is what we cannot do. We had very different projects of housing buildings, a community center too. Thankfully with Friends of DR, we also had the National Collecta, that is this activity when we mobilize to the streets to create conscience, to fundraising with young people. And also we have the community development through participative diagnosis, and also all of these activities we were planning to go to new communities, to new sectors, not only in Santo Domingo and Cibao, but also to expand to new places. And this has been a little bit diminished, and also the COVID has presented a new kind of solutions for us, as working with Wine to Water to giving water solutions, also to create solution of emergency kits of food and also of hygiene for all of this matter of bienestar and safety, health safety. And we are doing that right now. We also have been creating a new survey in all Latin America, but also in Dominican Republic, to diagnose what are the new necessities of the communities related to the COVID-19, and also what are the needs about what they already had. All of these slums that used to live in poverty, the emergency just keep increasing, and we create this survey to understand a lot better what is happening in the communities, and how we can give more appropriate solutions with them. We also keep looking forward to different infrastructure solutions, as also could be the water tanks and also the community centers. We have been reformulating everything in virtual, because all of we do through volunteer projects, and we are challenging also our teams to recreate new ways of creating solutions with the communities. We have been also creating a capacitation with the leaders, when we are teaching them how to use Meet, how to use different technological and educational solutions for decreasing this breach, this side that brings apart the community, because it's not only the fact that, okay, the community is there and the community supposedly cannot go out from the house. So we are creating new solutions with the educational process of keeping also the community together with the process that we used to do in our work model.
Thanks, Carlos. And that is a good segue into our next section, which is talking about how COVID-19 is impacting things in the DR. So for our audience, as of today, there's been over 100,000 cases of COVID in the Dominican Republic. And sadly today, DR crossed the 2,000 mark for a number of deaths in country. So I'm sure a lot of our audience members are not based in the Dominican Republic, they're in the United States. So can you all talk about what is daily life like in the Dominican Republic? Were there restrictions? Have they been lifted? How are things just on a daily basis? And then how is that, those restrictions, if they exist where you are, how is that impacting your work on a daily basis?
So I can start us off here. It goes without saying that our work and our lives have changed quite drastically since March, as I'm sure as many of yours has back home as well. But this is kind of becoming the new normal, right? In international development specifically, we have all taken that approach where you have to be flexible.
Yeah, we're in contact with one of our colleagues who's the regional coordinator of all of the clinics, the health clinics here in Constanza. And we just spoke with him, and the good news is, here in Constanza at least, is that according to him, the numbers are constant here. So they're not increasing, but they're also not decreasing. It's stable. But as you said, like, our daily life has been significantly impacted. There's mandatory mask wearing in the streets, and we're actually very thrilled to see that the overwhelming majority here in Constanza are complying with the mask wearing. And there's also a daily curfew in the country. So at 7 o'clock, you have to be, off the streets.
Yeah, not to mention, you can't do those Dominican greetings, right? When I see Joel, I can't give him a hug and a big kiss. Now we have to do it from distance. So kind of, changes the way you interact with people. But yeah, when COVID first hit, we immediately dropped everything, right? We started to think about how we could have the most impact. And so we stopped our data collection, we stopped our programming for about 6 months now, but we constantly looked for new opportunities, and we immediately identified a couple areas in which we could focus, right? Long-term, we could focus on food security, because if this pandemic doesn't go away, that's going to become a really, glaring issue. More immediately, we can focus on PPE. We know that, hospitals were not prepared for this. Nobody was, right? And so that's an immediate impact that we can make. And a need we could fill, right? Masks and hand washing facilities for community residents. It's really simple, effective solutions that we know work and, have worked to date. So we really started ramping those up and started making homemade ones, as well as, got really great donations from Constanza Medical Mission and Health Outreach Foundation to really support that cause. And then really, our main goal and what we've really tried to focus on is supporting those frontline responders, right? They're our colleagues. They're our friends, and they really have been going above and beyond. So we thought we should too.
I can say in our case, as well as Scott mentioned, things just changed. We were from an awesome school Gantt chart in March, full blown, to getting these, ordinance by the government. I must say, the DR has not done too bad for other countries. I mean, look at Brazil, for example. So, I mean, it's sad, 2,000 lives, but you look at other countries, they've taken COVID very lightly. So it's very commendable to know that in the DR here has been has been good restrictions. I remember in March, we couldn't get materials. We couldn't get, you couldn't leave if you didn't have a permit after a certain hour. Schools were closed. And most of the rural areas and the cities, people are wearing masks. So it's like Scott said, people are obeying the restrictions. In the cities, it's a whole different story. I don't go too much to the city of Santiago, which is my closest city. Santo Domingo, Carlos can speak for that. But for the area that we work with in the Cibao, people were kind of scared a little bit. So they would wear their mask. And as time went on, I say probably till late May, June, July, people were really, really respecting all the restrictions. Even now, like Scott said, it's the norm now. You see, we were jogging with our mask, and we see people jogging 6:30, 7 a.m., and they had their mask on. They might not have it on, but they have it with them. And this is the first time in all my almost 40 years that we're starting virtual school in the DR. I mean, come on, November 2nd, virtual school with the new president and the new Minister of Education starting virtual school November 2nd. All the kids are getting tablets and computers. I mean, come on. So we miss those days. I like what one of our team members said. She says, life is different now, a little bit colder, because before we used to visit a community or school, and the people would come, the kids would come to give you a hug or a smile. But now we just look each other in the eye and we do sign language. Like, we take a little data, but we got to keep those social distancing. And so it has changed. I think the approach, the human touch is always what we miss the most, I say right now. But we're doing what we can, taking the precautions. We quickly switch our focus into hand washing stations for basically healthcare facilities. We have reached over 300 in the country. A third of that's been thanks to you guys at FDR. So we just really keep pushing those hand wash stations. We just sent a report to them that said 10% of UNAPs only had places to wash their hands. 10%. So in my little town, there's like tons of these little clinics. So people will go, they'll be coughing or something, and they didn't have a place to wash their hands. So we're so happy now when I drive by and I see one. It's just a small thing, but it makes a difference. It starts to kick in. Like, even this is the biggest impact that I've seen in the DR. People are washing their hands more. Woohoo! Even before COVID, I would be like, that guy didn't wash his hands, or so-and-so didn't wash his hands. But now, because of COVID, that's been like the biggest thing. Like, people are more aware, you need to wash your hands. And so that's been a great positive thing about COVID.
Yeah, Joel mentioned kind of things getting colder and being farther apart, and that's definitely, travel and group education and experiential education is a social activity, and the kind of projects that we do are social projects, and people are in there shoulder to shoulder and working on projects together. And we mobilize resources from student travelers. So when travel ground to a halt, that was really disruptive for us. We had been running trips, everything was normal in February, and then March came, everything shut down. And so kind of part of our regrouping, as we were all, I guess, mourning our jobs, we were still putting our heads together to try to figure out, okay, what can we do in this moment, in this situation? And so Friends of the DR has helped a lot to support our food security initiative. We've been providing kind of food and basic hygiene kits to families in the 6 different bateys near Consuelo. And that was on suggestion of our community partners. We called them up in March, April, and said, okay, like, what do you need? We can't bring you student groups. We can't bring you construction work because all the hardware stores are closed too. Like, even if we were out there, we couldn't have bought materials anywhere. So they said food and, you know, bleach, soap. So we started to make that happen. And Friends of the DR made a donation to help continue that work, which has been extremely helpful. And yeah, I think besides travel grinding to a halt and everyone being a bit farther apart, something that's changed substantially has been kind of the disappearance of the informal sector, which is kind of why we had to do a food project in the first place, because a lot of the people in the bateys where we work make their living in the informal sector. They work on construction projects and get paid under the table. They sell food. They drive motoconchos, moto taxis. And so all of those informal income sources that depended on people moving and people going to their jobs and people just interacting disappeared. And I think that's slowly starting to come back, but to sort of fill that gap, the food kits and the hygiene kits were very helpful to help people kind of make it through that stay at home period.
Thanks, Brendan. And Carlos,
Well,
yeah, how are things in Santo Domingo? Joel thinks it's crazy there.
It is.
yes, here it's a very different panorama. It's a very big city with very different realities. Yes, colmados are still open, but with a lot of measures. But I think that every neighborhood, every barrio, have a very different reality. I've been in almost all of them because we've been supporting different communities. And if I go to Cantini, that is the usually more affluent with more money sector, there is a whole different reality of communities when, as Brendan said, there is a lack of sustainability of life, of ways of life, of sustaining a lot of jobs. A lot of people from communities has lost their jobs, has lost the informality that is very normal, and the new normal is not so informal. And that's one of the biggest, I think, breaks that we are seeing in the communities and people. Also, I think one greater thing is that I was never seeing in my years here and in my experience in Dominican Republic, the NGOs and the government and the society more together than ever. It's incredible that despite all of this situation, despite all of the breach that it has created, the COVID and the social economical failure too, we've been more capable of working together, for example, with Wine to Water and with another NGO. Techo is also part of different initiatives from the civilian participative movement, also from Casayat, that is a different movement to support the housing laws in Dominican Republic. And we also have a different reality, that is, there was a change of government, and this change of government too is creating also different dynamics. There is a new change of roles, a new different change of whose people is maintaining their jobs. And Santo Domingo is very crazy, very, very crazy. I used to go to the community in public transport. Now I cannot do it because it's a lot more risk. We need to hire only people who really have the safety, the health insurance and all of that, because if not, it is also a risk, not only for us, but for the communities. And trying to maintain that warm communication with them has been a real challenge. And we are adapting to maintain that volunteer team with that community part too. And it's a challenge, and I think it's a call. We believe it's a call to working together to increase how, if you have some resources, if you have some knowledge, and we have some, we need to work more together than ever before.
Thanks, Carlos. It's great to hear some silver linings here, Joel, with hand washing, and Carlos with more collaboration with NGOs. A lot of you have talked about how prior to COVID, you relied on volunteers coming from outside the Dominican Republic, or from within the Dominican Republic, going to different areas. So how are you trying to, I think, Carlos, you talked a little bit about trying to maintain that connection between the volunteers and the communities that they serve. How are you all working to do that? Are there any creative or innovative ways that you have been trying to maintain that connection?
Well, we have a very big database of people. We used to work a lot with voice to voice, with WhatsApp groups, with Instagram, with social media too, also to keep that connection. And we have also do it through the same leaders and through the same communities. We have created digital educational spaces. When the leaders talk about their experiences, they talk about how is this reality confronting them, and we invite the volunteers to hear them, to speak with them. And that has been one of the most interesting strategy to keep that connection. We have also mobilized some different volunteers, giving the food and hygiene kits, also with all of the safety and health protection. And they tell the story they are seeing, they tell what they are learning. And recently we also recruit new volunteers through different activities. We used to work with the schools, with secondary schools, and they are also calling to the communities. How was the kid? It was good enough. How are you feeling today? How are you feeling through all of this context? And that has been one of the ways that we keep connecting, at least in a more virtual way, but it has been a very useful, and people ask every time, how is the community? How is Pedrito in the community of San Pedro? How is Marjeline in the community of Las Malvinas? And that kind of touch is very important to keep people understanding that there are different realities that we could keep supporting.
Yeah, that was great. For us, really, we haven't been super active these past 6 months in the communities, unfortunately. A lot of our work is that face-to-face interaction in those community meetings and the door-to-door visits. And so it's been truly just very difficult, as everyone has mentioned here. But one creative solution that we found for a lot of our educational components, right, because we still wanted to continue the hand washing stations and water filters from Constanza Medical Mission. And so what we did was move our charlas to online versions on YouTube. And so it was way easier to show people from a distance. You can send them a link, or you can show them on a tablet from far away. And that was a pretty creative solution.
Yeah, well, just to add to that, one creative idea that we had was a couple of our volunteers actually have colmados in their local communities. And so, the neighborhoods there tend to still go to buy food from those colmados. And so we made those the distribution points of our hand washing stations, for example. And so with that volunteer who was the owner of the colmado, he contributed materials, and then we could send the training videos and the extra support and check in with the recipients.
And we also made a really cool DIY hand washing solution that I'm sure all of you with Peace Corps remember. It's that 2-liter bottle that hangs from a string, and you open the cap to wash your hands. So we made a video explaining how to make one of those, and within a couple of weeks we had 120,000 views just in the Dominican Republic alone. But most of that feedback we got was people telling us, this is a great solution, muy chulo, and all of that, but it's not practical for a family of 4 people.
Yeah, and so that's when we really, went to our partners, Wine to Water and FDR, which was fabulous, and we were able to actually distribute 130 hand washing stations, and we're set to do another 250 in the coming months.
Excellent. If you guys could share those videos in the chat, if you have them easily accessible, if they're on your website, where people can go watch them if they want.
Yeah, I would love to see the video.
Absolutely. We'll share the link.
And the other is we might be able to put them on our FDR Facebook site, and other former volunteers would spread them out to the people they know.
This is Janice Jorgensen, one of our Friends of the DR board members, membership guru. If you ever need to find another volunteer in the history of Dominican Republic, ask Janice. She can help you out.
Perfect. And I'm not sure if I have it currently on this computer. I know it's on our community or our country director's phone. That's where I think it's easy. So Susan, maybe I can send it to you and we can get it sent out afterwards if I can't put it on the chat.
That'll be great. I'll be sending out the recording of this event to everyone who's online and some other people who asked for the recording. So we can definitely include any videos or any other resources any of our NGO partners here with us tonight want to share with the group. We can definitely make that happen.
Yeah, videos I think have been a key way that we've been staying in touch with all of the students and all of the community that's been helping us around the world to support the food and hygiene kits project. We've had kind of the community leader, Roberto, made a thank you video. We have a staff member, Angelica, who lives in the community, and she's been helping us a lot with the kind of the purchasing and the delivery of the food. And she made kind of a guide to how this goes down, what happens. Like, this is what happens in the storage, in the almacén, the store. This is what happens on the road. This is how we package the food. And so I think those videos have been really great in kind of channeling interest and contributions from our huge network of students and their families and people who know and love the DR. And yeah, they've stayed connected that way. And then something else that's really cool that we did kind of outside of the project is like a critical issues virtual week-long experience where we had students sign up to learn about the issue of statelessness and undocumentation in the Dominican Republic, which affects people in the Bates especially hard. And so we had students connect every day for a week and do different online experiences, talking with members of our local team, watching videos, and kind of like digesting and digging into this really complex issue of citizenship and statelessness, kind of keeping people engaged with some of the bigger picture things that have been going on pre-COVID and will still be a problem post-COVID, and just keeping people connected in a critical way to the DR that way.
And for us, I think we miss very much the GXP groups. They were paused, obviously, since March, and they will spend a week, maybe a little bit more, depending on their schedule with us, and go out to the communities. And our HQ office kind of takes care of on the US side. We did beefed up our social or virtual. We open up an Instagram for DR. I'm not very techy, but I had somebody help with that. And our Facebook page, posting some videos and photos. We have tons of photos we can send you, Susan and Kim, of all the hand wash stations all over the place. And that's been our way to, keep informing our community, our Wine and Water community, that we're still here, taking precautions. And when it's crazy out, I tell the team not to go out. That's just the way it goes. And where cases were going up in Iguerito, then you take the precautions and so forth. But we're more than happy to provide you with any media that we have. Susan, some video. We've been trying to be really careful to get too close, because of the social distancing, obviously, and to get too involved. But we did develop a couple of nice seminars online. One of them was how to treat someone if they have COVID. People were a little afraid and skeptical. So some people wouldn't say they had symptoms, or what they do if the mom or the grandma or the uncle, whoever had COVID. So we did some of those, like Instagram Live. You guys know more than me. and that we saw that helped a lot. And we preparing our school wash program for November, because some of the schools will be doing virtual. So we get a slot where we can do our wash program virtually. So we're setting up our wash program now, and we'll do it in the school, and we'll just set up in the classroom like we would do before. So that's the way we've been kind of keeping in contact with the outside.
Right. As a former education volunteer, that makes me super happy to hear that you're going to get some opportunities to connect with students online on a very important issue. I see some comments from Marcus in the chat, and Marcus, I'll make sure to cover those topics when we get to the Q&A section at the end. Now I wanted to, in some ways, turn the tables and ask our NGO partners here tonight, what are your needs, and how can the people online with us tonight or who are viewing this later, how can they support the work that you all are doing? What can the RPCV community do to help their family and friends in the Dominican Republic?
I can be a little cliche here and say, the best way to support is through donations. Those $5 to $10 are just truly so greatly appreciated, and it really does make a difference. You can also go on our website, and you can also buy one of these awesome T-shirts you can see us rocking tonight. But really, there are just dozens of other ways to help. We're always looking for software developers or grant writers, marketing experts, education, volunteers. For example, we're working with one now who dedicates about 10 hours a week and has truly been such a tremendous help for Hope Tambala. So thanks, John, if you're watching this, you really are the best.
Yeah, and we're also looking to expand our programming to new communities. So if you know motivated individuals in those communities or international organizations that are working here in the DR, we'd love to get an introduction with them. We'd love to possibly form a partnership and work together.
Yeah, in general, any RPCV brings something to the table, right? I really believe that. And if there are any RPCVs that want to help, please reach out, and I'm sure we can find a way for you to get involved.
Yeah, Tivan, let's definitely chat about that. I would love to put y'all in touch with some of the people that we work with in the communities. And yeah, I think just in addition to donations, kind of spreading the word among your networks of kind of the donation pages that are up and the issue pages that are up and still running. Even if you can't donate right now, because we understand that everyone is in a different situation. A lot of us are in really rough situations. It's free to repost and click and send people things. And the more people we get talking about this and aware of it, the more likely it is that we can get some sort of continued support. I guess Susan can maybe send out the link to our fundraising page so you can see what it's all about, what the DR Community Relief Fund is all about. And from a tourism perspective, once it's safe to travel, and if you have a trip booked, don't cancel it, postpone it. Just a little tourism and travel plug there.
Well, we currently have a campaign called Voluntad Frente a la Emergencia. It's like a wheel in front of the emergency. You can go to support that campaign in Dominicana Solidaria. That is a great platform, very safety. You can see there all of the information. Where are the money going? Where are all the donations going? Where are we doing with all of that? And we also need right now a lot of support from technical partnership with another NGOs, because as I told you, we have information of new needs of communities. That's also one of the things we do most, even more than housing solutions, is the information of what the people really need. And we are going also very soon with the Colecta Nacional. We are changing from the streets to somehow the streets, but virtually the streets on the social media and how we could also create conscience through these campaigns and connecting with more people to increasing how the data we have going to more communities, because there is a lot of places that we are not going. There is a lot of people, of families, of communities that we are not knowing what is going on there, and that we could increase and enhance our intervention in those communities. And for us, it's through that portal, the Dominicana Solidaria, and also through the portal that we are going to tell you a little bit later, like in the 1st of November, the Colecta Nacional, through another platform, and that will really increase the capabilities that we have right now, and also have the capabilities to mobilize more people. As I told you, we have been going to the communities. If there is one of these people that kept here in the Dominican Republic and want to see a little bit more about what is going on, and go to delivery some kits, or even so to do some survey or anything like that, also they can, that people could write us directly, and we could evaluate if they could participate, or even in the virtual spaces. And that's it. Donations and a lot of support also to increase the network of supporting through different NGOs, and also to partnership with some more local communities.
Great, thank you, Juan. It looks like we have some people in the chat wanting to see the links of where they can donate. So if you can put those in there, hopefully you'll get an uptick in donations tonight or in the next few days. We have a question from Lori here. If any of you all have open employment opportunities, and it sounds like Puente, you have plenty of opportunities to volunteer, but are there any open positions at your organizations?
Yeah, that's a great question. So currently, we do not have any open employment opportunities. We have really grown our team quite exponentially this past year. So we've kind of made all of those for sure hires. We're going to hire one UX designer on in January, but for that beginning of that next fiscal year, which is in June, yeah, absolutely, we're trying to scale and expand our team and our outreach. So typically we always start with a volunteer for a couple months until we're both really sure that this is going to be mutually beneficial, and then we kind of go from there. But at the current moment, just volunteer opportunities. I'm sorry.
Thanks, Scott.
I'm sorry. We actually have two open opportunities right now for a part-time grant writer. And then I was trying to hurriedly get on our website to see what the official title is. But the other one, and I'm going to put it in the chat, is more of a technical position. But I'm going to look it up now and I'll stick it in the chat.
Great. Excellent. Thanks, Stephanie. So I accidentally switched into our open question and answer section without officially saying it's question and answer time. So if other people in the chat have questions, they can feel free to put them in there now, or turn your microphone on. I know, Marcus, you had some comments and questions in the chat. It looks like you're in Santo Domingo yourself. Did you want to come online and say something? It looks like you have your own organization and doing great work with hand washing stations.
Thank you. Yeah, so I work for an international nonprofit that's implementing a USDA funded Food for Progress project with a bunch of local nonprofits, La Junta Agroempresarial Dominicana. I've reached out to Joel, where we've connected to distribute a bunch of the hand washing stations to a lot of the milk collection centers that we work with. So my project is working to support the beef and dairy value chain throughout the country. And the hand washing stations, especially once the pandemic hit, it seemed like a perfect fit for what we're doing at the community, the milk collection centers, as well in other areas. I believe I've reached out to Scott through Facebook. And not Brendan yet, but since I've been here, I've been trying to reach out to the Peace Corps network and see if there's opportunity for our organizations to collaborate, especially at the community level where where the Peace Corps volunteers tend to be located. So like I said in the chat, if anyone's in Santo Domingo anytime soon, I'm more than willing to take anyone out for a coffee, a presidente, or lunch or something so that we can talk. Of course, doing social distancing, see if there's any sort of opportunities for us to collaborate or some sort of way to work together in the future. That's it. Thanks for the time.
Great, thanks, Marcus. Yeah, securing the food supply chain is definitely something very important. So it's great that you're able to help improve sanitation. We've had serious issues with that in the United States. It's our poultry factories. So great work that you're doing. Do we have other questions or comments from those who are online with us right now? Otherwise, I have backup questions I can go to.
I can go. Susan, this is Paul Vitello from Constanza Medical Mission. And, given that we're all sort of thrown off our normal flows due to COVID, Scott and I have talked about this. There's a whole pile of people working in the DR, and it just seems like a good opportunity to try to bring that group of us together to talk about strategy over the next, I don't care, 1, 3, 5 years. We all think we're working on the most important areas, but is there an opportunity here to discuss what the people in the DR are seeing and what they see as the bigger issues coming down the pike? I mean, we've all proven we can change our approaches over the last 6 to 12 months. So is there an opportunity to get some brains together and figure out how we can go after sort of bigger, broader issues in a different way going forward?
So that is a great question, and as Paul said, we've talked about this quite a bit. But this way of thinking is one of the many things we love about Paul. That collaborative spirit is huge, and in my opinion, events like this are such great opportunities for so many different organizations from so many different sectors to come together and put everything out on the table and have a little Q&A. So I think more opportunities like this, in my opinion, would be fantastic, right? Conferences and virtual events really could pave the way to kind of get that collaboration and everyone on the same page and share strategy, because we're all working towards that common goal that and we just want to better people's lives in whatever form it may be. If it's education, food security, data, whatever it may be, our goal is all shared. And so yeah, I couldn't agree more with you, Paul. I'm a little biased maybe, but really great question.
Yep, I think that was a great point, Paul. And last night we had our Friends of the Dominican Republic board meeting, and we had Jennifer McGowan join us, who's the acting director of Peace Corps. And she said to us how happy she was that we had formed these partnerships with NGOs, because without volunteers being in the country, that's a huge part of our mission of Friends of the Dominican Republic, is to support volunteers in country. So I think COVID-19 is making all of us, all NGOs, all different groups think about how can we diversify everything that we do and all of our funding streams so we can be agile and continue to do important work when we can't get volunteers into the country. What do we do? Whether they be Peace Corps volunteers or just volunteers down for 2 weeks, how do we keep that work going? How do we engage with the community? So I think Friends of the Dominican Republic, we'd definitely be interested in talking about that and how we can continue to help support Dominicans with COVID-19, because it doesn't look like this is going away anytime soon.
Yeah, I really like the idea, Paul and Marcus too, of being connected and kind of having a group where we can chat and talk about possible ways to connect and ways to support one another.
This is Kim Herman. We'll put that on our agenda and see what we can do about maybe organizing some other convenings, starting with all of you. Susan, do you want to mention how many people registered and may be looking at this, the video of this later, just so the panelists and people have an idea?
Sure. We had 50 individuals register for the event, so they'll be getting this email, an email of this recording directly to them by tomorrow. And then we'll have our Lavos newsletter coming out later this month, and we'll have an article about this with recording link to it. And that will go out to, I think Janice knows the exact number, but I believe over 2,000 members of Friends of the Dominican Republic as well.
2,500 active emails.
Mm-hmm.
Yeah, and we do welcome any articles up to about 350, 400 words with at least one photo for the newsletter in the future. And again, you can send that to me at president.fotdr.org. I'll make sure it gets to our editor, or send it to Susan too. You have her email, she can get it too.
Easy. And it might be really good, you know, if you got, even if we got blurbs in before the end of the year, so people who are donating before the end of the year, don't, you know, for their contributions or RMD money.
And don't forget, we do have through our programs, Community Challenge Fund and Program Support Fund, which we have money available. So don't, you know, if you've got ideas for new programs or continuation of what you're doing, you know, throw it at us and we'll take a look at it.
So I'm not seeing more questions in the chat, but I have another question that I wanted to ask, because I think it's something I've been seeing a lot on my own social media, and that is RPCVs who still have a good connection with the communities that they served in the Dominican Republic, searching for ways of how they can help their community members who, like Brendan said, the informal sector has been severely impacted by COVID-19. And so they're trying to get funds to their neighbors, to their friends who are in the DR. Do you all have recommendations for the best way to go about that if an RPCV wants to support the community they serve directly through some kind of fundraising program opportunity, or do you all have opportunities maybe where they could collaborate with you?
Yeah, that's a fantastic question, and I can kind of kick it off here. But yeah, so we are here on the ground, you know, 24/7, and like we said earlier, we are always looking to expand into new communities and bring more motivated individuals on board. So please send us an email. You know, we have our process, which always starts with that community meeting, data collection, then needs prioritization. But then we work with the community and our partners to implement the appropriate solution. So, you know, we would love to expand to your compo or a compo near you. We just really need to have one of those motivated individuals that can really take the lead and kind of be that force for good, if you will.
Yeah, I would say, you know, I've seen successful kind of crowd-funded fundraisers that are very specific to communities or families even. So I would say any volunteers that are interested in knowing how they can help should reach out to the people that they lived with and worked with and know in the communities, and see if there's anything specific that they want or need or are lacking. And then, I mean, any of those platforms, the details can be figured out with a Zoom transfer or whatever, but I think the most important part is figuring out what exactly the need is, and then how to communicate that in an effective way that convinces people to donate. And then from a Rustic Pathways perspective, especially if there's any volunteers out there that were CED volunteers, community and economic development, and we're working in something related to tourism, or even something that could tangentially be related to experiential education or tourism that's been affected by COVID, definitely reach out to me and we can talk about what that might what support for that program might look like once the tourism sector gets back up and running, because that's the kind of thing that we love to support and have our students visit and learn about, are these kind of small scale, more interesting, in my opinion, experiences kind of off the beaten path.
We are also very, we think social media is a powerful tool that we need to understand. And I think many times NGOs, we go and we are so many times in community that we used to forget a little bit how these tools are very powerful, are very communicative. And everyone who wants to also to share some of our stories, some of the stories of the communities, also to share through their own networks. I think this is all about how to reconnect on, or creating more powerful connections and networks between all of us, between our NGOs also as the people. And we also have a lot of expectations to go to new communities. I said a little bit before, to go to new places where there are another needs. We have tools, we have also a model that could create a survey and participative diagnosis that could evoke which are the real needs of the community, and that also could create new different projects through all of us and different other NGOs or partners, or also government, or also society. There is a lot of information out there that we could redirect and create powerful solutions with that, and also reconnecting to different donations of people and different also knowledge of places. If there is some people who get stuck in a different community like Barahona, and there is a reality going on there, well, we are very happy to receive that information to evaluate how we could go there, or any of also our partners. And that's.
Thank you, Carlos.
That's exactly what I was just gonna add, Susan. Just let us know if it's in the Cibao area within the communities that we work with. We're more than happy and arms wide open. And if you think outside the box and you want to send a box of clothes and you say, hey, Joel, this box of food or this box of clothes from the States, can this get to this community or XYZ family? We'll figure something out. So just let us know. I think that it will be a per case scenario. Obviously, money's a sticky thing, so we don't recommend sending money per se, but if we have to know what is the need, then of course we'll be more than willing to help. We're really in the same boat, all of us. So thank you.
Thanks, Julie. I hope you don't get a lot of mandados after this. So I wanted to share that next year, Friends of the DR is going to be organizing a speaker series. We want to keep our members engaged on different topics. What do you want to keep engaged with regarding the Dominican Republic? Do you want to learn about where's the best chocolate being made? Do you want to learn about the history of baseball in the Dominican Republic? Do you want to hear more about the Haiti-DR relationship and how that's going under the new presidency? We want to know what our members want to hear about. So I'm going to share a link in the chat for you all to complete. We're also going to send this out in our next newsletter. And hopefully we should have some really interesting speaker series going on for you next year. And if anyone has a speaker in mind that they think would be great for the broader Friends of the Dominican Republic membership to hear from, please share that with us as well. We're always happy to organize other events. And likewise with our NGO partners, if you have a great idea for an event and you want us to help participate or share that out with our members, we're always happy to do that. I see Tom has some great ideas about chocolate, so that's excellent. If only we could taste the chocolate virtually as well. So I'm gonna give one more opportunity to our NGO partners to share some closing thoughts that they have, or any information that they want to get out that we didn't cover tonight before we close this evening's session.
Yeah, well, thank you. First and foremost, thank you FDR and Susan for putting this all together. It really was great to see everyone and hear some familiar voices. And a huge shout out to, Techo, Pathways Dominicana, Wine to Water. We really have enjoyed collaborating with all of you thus far. And we really hope to continue, luchando juntos, right? We're in this fight together. And I really appreciate, giving us this opportunity to share a little bit about our work, and everyone that has participated back home. We really appreciate it.
And those other organizations, we look forward to collaborating with you as well. Thank you so much for being here today. We enjoyed it a lot.
Yeah, we just want to say muchas gracias, buenas noches. I have a map of the DR. Obviously, we would like to fill it with projects. So just, keep doing what you do for us. That's all we can really say. And when you're here, we're only 5 minutes from the Santiago airport. Please stop by. Don't even ask. I'm only a minute from the factory. You have a place to stay, good coffee, good water. Rada will cook you up a pig. We'll just have fun. So just come and visit and keep doing what you're doing.
I still have that Rada signed coffee cup I got down there. Well, on behalf of FDR, thank you all very much for participating, and we certainly enjoy the partnerships. And please do send thoughts and ideas for speakers for the next series to Susan, and we will take advantage of those. And again, we'll continue to work with you and we'll do everything we can to improve our programs in the DR to help more Dominicans. So Susan, back to you for the formal goodbye.
I don't know if Brendan or Carlos have anything they want to add.
Oh, just thank you for the space to share about the work that we're doing and get to know the work that other people are doing in the DR in this COVID context. And thanks FDR for the support and for the moderation, Susan. Great job. Yeah, and looking forward to connecting. Ya te saben, if you're in Santo Domingo, a la orden.
We are very grateful for being here in this space to sharing with all of you. As we used to say, we always like to connect to people, and I think all of this panorama, all of this situation, it's an opportunity to say, okay, we really need to connect now. We really need to work more stronger to create more partnership, and we are very glad to be here. Anything you need, anything we could also support in other projects, we are very happy, and thank you very much. Thank you.
Well, thank you, Carlos, Tiven, Scott, Joel, Brendan, Stephanie, Camille, for all participating tonight, and Paul, and all the volunteers who came on board, all the Friends of the DR board members who participated. Friends of the Dominican Republic, we can't do the work that we do without donations from RPCVs. So we really appreciate those of you who donate to us, and that we can then give that money directly to these great NGO partners of ours and get things implemented and on the ground to the people who need it most. So I want to thank all the RPCVs who are here tonight with us, and hope we can all one day meet in person in the future in the Dominican Republic for a great Peace Corps anniversary someday in the future. And so with that, I'll end things for tonight. Y'all will be getting this recording tomorrow morning. And if you have any questions, you can shoot me an email, and I'll be sharing all the information that the NGOs put in the text chat box tonight in the email tomorrow. And if you have any information you want to share, send that to me and I will get it out to everyone as well. So thank you everyone for your time tonight. Pasen buenas noches. Have a good night, everyone.
All right, thanks y'all. Have a good night. Buenas noches.
Great job, Susan.
Muchas gracias.
Yeah,
Thank you again. Take care.
Bonita noche, gracias.